Hello, my name is Mayra. I'm going to be your nurse for today. I'm going to be asking you some questions. We're going to be examining your head, your eyes, ears, nose, and throat.
Okay.
My first question is, have you had any head, skulls, facial fractures in the past?
No.
Any surgeries?
No.
Any headaches?
No.
Dizziness?
No.
Any swelling of the face?
No.
Any sinus infections or tenderness?
No.
Do you suffer of any nasal discharge or post-nasal drip?
No.
Any nosebleeds?
No.
Any mouth lesions, ulcers, cold sores?
No.
Any difficulty swallowing or chewing?
No.
Any changes on your voice and sound?
No.
Any allergies causing you difficulty breathing?
No.
Any neck injuries or surgeries?
No.
Any ear infections, eye surgeries?
No.
Any family history of glaucoma, cataracts?
No.
Diabetes, high blood pressure?
No.
Stroke?
No.
Okay, and when was your last eye exam?
A year ago.
A year ago. Okay. Next, I will do your physical assessments. First, I will start with your head and your neck. I will look to your hair for normal structure, for normal symmetry, for the quality. Okay, first I'm going to start by inspecting. Okay, so by inspecting, I can see that the face is symmetrical. Eyebrows are symmetrical. The skull looks symmetrical. Ears are symmetrical as well. I'm gonna feel for your skull, your hair. No hair loss is noted. Hair is smooth. Good quality. No lesions. No masses. Okay. Any pain?
Negative.
Okay. Okay. So by facial symmetry, we could also see that there is no drooping of the face, no tics, nothing going on there. Your frontal and maxillary sinuses. I'm going to check. Any pain?
No.
Any tenderness?
No.
Any pain?
No.
Any tenderness?
No.
Okay, so the maxillary and frontal sinuses are good. Okay, I'm also going to check for your temporal arteries, which are right here. Okay, any pain?
No.
Okay, they're good. Alright, I'll inspect the neck. The neck seems symmetrical. There doesn't look no lesions, no masses, nothing. I'm gonna pop at your neck. Any pain?
No.
Okay, good. Symmetrical. Okay, I would like for you to please, I'm gonna be checking range of motion. Can you please look to your left side? Okay, any pain there?
No.
Okay, come back to the middle, please. Okay, go to your other side. Okay, any pain?
No.
Come back to the middle, please. Okay, so as we can see, there is no pain. Everything is symmetrical. Can you please smile? Okay, everything is symmetrical. Eyebrows are even. Eyelashes are well distributed. It's symmetrical as well. I'm going to be checking next for your lymph nodes. Okay, any pain?
No.
Any pain right here?
No.
Any pain right here?
No.
No tenderness. Smooth. Okay. I would like for next to check for the tracheal position. First, I would like for you to tilt your head back. Please swallow. Okay. From inspection, first I could see the trachea is midline. When he swallowed, there's no masses, no lesions, spouts. Everything seems smooth. Please come back. Next, I will have you take a sip of water.
Okay.
And then you have to hold it. When I tell you to swallow, please swallow.
Okay. Thank you.
Take a sip of water, please. Okay. Tilt your head back. Swallow. Okay. Come back to the middle, please. Okay, everything is symmetrical. No lesions, no masses noted. Trachea is midline, symmetrical. Please take another sip.
Thank you.
Please hold it. Tilt your head back. Check the other side. Okay, swallow. Okay. Come back to the middle, please. Everything seems okay. The thyroid sides seem fine. There's nothing enlarged. Everything is symmetrical. It's consistent. Okay. Next, I will check for your, I'll palpate, inspect for your carotid arteries. Nothing bulging. Nothing's distended. Your jugular vein distension, I will check as well. There's nothing bulging. Nothing is distended. I will feel for your carotid artery. Okay. Good. Check right here. Perfect. Okay. Okay. Next, I will auscultate your head and your neck areas. Okay, so first I will auscultate for your temporal arteries. Good. Good. Next, I will check for your carotid arteries.
Okay.
That's good. Good. Okay. I will also auscultate over the eyes. I did not hear on your temporal arteries no bruits, carotid arteries no bruits as well. And now I'll be checking your eyes. Please close your eyes. Good. No bruits. Okay. Next, I'm going to have you open and close your mouth. I'm going to be checking your TMJ, which is your temporal mandibular joints.
Okay.
Okay? Open, please. Close. Open one more time. Close. Okay. No popping, no crepitus was noted. It opened smoothly. Did you have any pain?
No.
Okay, good. Okay. Next, I would do the vision testing. We do not have, for the purpose of this test, no Snelling chart with us right now. But if we would have a Snelling chart, I would ask you to step 20 feet away. I would ask you also to read it. And you'll be covering, you'll be reading with covering one eye and then covering with that eye as well. Read it, and then the next eye will be covering, and then you'll be reading it with both eyes. This is to check to see if you have any 20/20 vision.
Okay.
Okay. The next, I will also do to check for the visual fields. It would be a confrontation test, which would be I don't have that actually right now either to test it, but you would be covering one eye, and I'll be covering that same eye as well. And this is pretty much to test your peripheral vision. So I would extend my fingers midway, and then you will tell me if you notice the fingers or if you couldn't see it as well.
Okay.
Okay? Okay, so I will inspect for eyebrows. Your eyebrows are symmetrical. Your hair texture looks symmetrical as well. Okay, the orbital area, there's no edema, no tissues, abundant, no lesions, no masses, nothing noted. Eyelids, inspection, please open and close your eyes. Patient opens and closes his eye freely. The eyelashes positions are normal. There is no ptosis, no tremors, no flakiness, no redness, swellings. Okay, I'm gonna palpate now to see if you have any nodules on your eyes. Please close your eyes. Okay, no nodules noted. Please open your eyes. Very good. Okay. Next, I will, just from inspection, the sclera looks white. There is no lesions. There is no discharge noted. The lacrimal gland looks intact. The eyes are not dry. There is no foreign bodies noted as well. Okay. Next, I will also use my pen light to check. Gonna check inside your eye. Okay. No foreign body. Conjunctiva is pink. No lesions. Nothing. Very healthy eyes. Brown eyes. Okay, nice. Alright. Okay, so, and the lacrimal gland was conditioned as well. Okay. Next, I will do your extraocular muscles. One test to do this is to test your 6 cardinal fields of gaze. Okay. First, I will ask you to please follow my finger. Okay.
Okay.
My finger.
Mm-hmm.
Just with your eyes, please. Okay. Very good. Okay. Really good. Okay. For the next test, I would have to be using an ophthalmoscope inspection. And I would be pretty much checking for lens clarity. I'm supposed to check for normal findings, would be a red reflex as well. I would check to see if there's any retinal abnormalities. Any normal retinal would be yellow and reddish and pink. Would also shine the light as well. And it should be... like I said before, I should see a red reflex using my ophthalmoscope. I would check for blood vessels characteristics, which the branches should also be defined. They should be sharp. There should be no hemorrhaging or narrowing. It should be reddish in color. That should be for normal findings using my ophthalmoscope, inspecting it right in front of the eyes. For the disc characteristics, it should be yellow as well as pink, and they both should be well defined. The next would be checking for depth of the anterior chamber, which I should focus more to check to see if the iris is illuminated. Okay. The next, I'm gonna do the macular characteristics, which tests the central vision. It should noted no, it should be intact. Okay. So that's next. Next, I would do the ears, nose, and throat. First, I will inspect as well as palpate and then test the ears. Okay. So, your ears from inspection As you can see, they're both symmetrical. There is no no masses, no deformities noted. Okay. Okay, nothing like that. Okay. So to measure the auricles in the mastoid area, I would use an imaginary line that would go from the inner canthus of the eye to the outer ear, and I should see no deviations at all. Okay. The color and position of the ears, they're both the same. There's no abnormalities noted, no swelling, no tenderness, no nodules noted as well. Okay. The auditory canal, by using an otoscope, I could inspect to see if there's any earwax, any foreign bodies, any lesions, or anything like that. So I would use my otoscope and I would check. Okay. I would also, obviously, I would use the otoscope and pull the pinna back as well before doing that. Tympanic membrane, I would also check to see for the color, if there's any perforations, or if there's any mobility. The normal findings would be not finding any perforations or any lesions as well. And the tympanic membrane should be pearly gray. Okay. Next, I will move on to hearing, assessing the hearing. As we noticed, my patient could respond clearly to the questions with no difficulty. The Weber test would be the tune and fork, which we don't have right now, which would be placed in the midline of the skull, right there. And this test is pretty much assessing the hearing. Is used to compare any hearing by bone conduction by air conduction as well. The next test also used for hearing is called the Rhine test. The Rhine test, we use the tune and fork over the mastoid process and then place it in front of the ear. So it would go right here, and then we'll place it right here to check for the hearing test. Again, this test is air conduction with bone function. Air conduction with bone conduction. The air conduction should be more than bone conduction in normal findings. A whisper test is the next test for hearing. This, I'm going to be asking you to say what I whisper. Just repeat it after me.
Okay.
I'm going to be using numbers. Okay.
1, 2, 3, 4.
Okay. Please, the next ear, same thing. Repeat it.
A, B, C, D.
Okay, very good. Good hearing. Okay. Next, I'm gonna inspect for the nose. The nose looks symmetrical. It looks like there's no lesions from the outside, no masses or anything like that as well. The size looks normal, shape and color looks symmetrical both sides. Okay, next I'm gonna test for patency. Please breathe. Please breathe. Okay. Any difficulty breathing?
No, not at all.
Okay, so it's patent. Also use my pen light as well to see if there's any patency. Okay, mucosa looks pink, moist, no lesions, no foreign bodies. Everything looks correct. Okay. No discharges as well, I did not notice. Color was pink. Alignment, the nose was aligned. Mucosa was aligned as well. Okay. I'm going to be touching for tenderness or pain in your frontal and maxillary sinus, which I already did before, but I will do it again as well. Okay. Please tell me if you have any pain or any tenderness when I touch. Any pain?
No. No.
Okay. So they're both decent and intact. No pain noted. Upon inspection and palpation. Okay. Okay, the mouth. Alright, the mouth seems symmetric. Please smile. Okay, symmetry is noted. No difficulty. Okay, next I'm gonna be your external lip seems pinkish. There's no edema, nothing noted. Check inside. Please open your mouth. Okay, I can see the hard palate. It's pink. No lesions noted. No cavities. Teeth look fine. See? Very good. Okay. Please close your mouth. Let me check your gingiva. Okay. Good. Pink and moist. Okay. No signs of gingivitis. Nothing like that noted. No edema. No foreign bodies. Gums are pink. Okay. One more thing, please. Can you please open your mouth and say ah? Stick out your tongue, please. Okay, perfect. Tonsils are symmetrical. Stop now. Tonsils are symmetrical. Uvula looks midline. Perfect. Close your mouth, please. Okay. Like I said, the teeth show no caries, no abnormalities as well. There's no missing teeth noted. Okay, the gingiva was pink. There is no bleeding noted as well. The tongue looked symmetric. Please stick out your tongue. Symmetric, no lesions, no discoloration. You can bring it back. No ulcerations noted, no swelling noted. Pink and smooth. Okay, can you please take out your tongue and move it from side to side? Any pain?
No.
Okay. So the cranial nerve number 12 was inspected and it was within normal limits. Okay. The tonsils, once again, I said that it was pink and symmetrical. The gag reflex, I would be using a tongue blade for this. I would tell the patient to stick out your tongue, place the tongue blade in the middle, and I should be, the gag reflex should be present when tested. Okay, so that is your ear, nose, and throat. Okay. Alright, so the next inspection would be the eyes. There's my eye sheets. Okay, the eyes. Okay. Sorry for the eyes. I did notice the pupils were equal and they were reactive to lights. Let me just do that one more time. Okay. Alright. Okay, so we did notice that the pupils were equal, reactive to light and accommodation. So perla was noted as well. Okay. Very good. Next would be, okay, we did the eyes, we did the ears, nose, and the throat, we did the head and neck. Okay. We are done. There's nothing else more to do. We did everything. Thank you so much. You've been a good patient.
Thank you.